Using the Punnett square to understand CF genetics. Cystic fibrosis is a genetic condition that affects many aspects of health, particularly the lungs and digestive system. Understanding how it is inherited can be complex, but a tool called the Punnett square makes it easier to visualize. Cystic fibrosis is inherited in an autosomal recessive manner. This means that a child must inherit two mutated copies of the CFTR gene, one from each parent, to develop the disease. The CFTR gene is responsible for producing a protein that helps control the movement of salt and water in and out of cells. When this gene is mutated, it leads to the production of thick, sticky mucus that can cause serious health issues. To use the Punnett square, we first need to understand the genetic makeup of the parents. Each parent has two copies of the CFTR gene. These can be normal or mutated. A person with two normal copies is not affected and is not a carrier. A person with one normal and one mutated copy is a carrier but typically shows no symptoms. A person with two mutated copies has cystic fibrosis. In the Punnett square, we representing the normal allele with a capital letter C and the mutated allele with a lowercase c, let's look at some common scenarios using this tool. First, if both parents are carriers, represented as CCCC, we can fill out the Punnett square. The possible outcomes for their children are CC, CC, and CC. This results in a 25% chance for a child to have cystic fibrosis, a 50% chance to be a carrier, and a 25% chance to be unaffected and not a carrier. Next, if one parent is a carrier and the other is unaffected, represented as CCXCC, the possible outcomes are CC and CC. Here, there is a 50% chance for a child to be normal and not a carrier and a 50% chance to be a carrier. Importantly, there is no chance of having a child with cystic fibrosis since two mutated copies cannot be inherited. Now consider a scenario where one parent has cystic fibrosis, represented as CC, and the other is a carrier CC. The possible outcomes are CC and CC. In this case, there is a 50% chance for a child to have cystic fibrosis and a 50% chance to be a carrier. Finally, if one parent has cystic fibrosis and the other is unaffected, represented as CCXCC, all children will be carriers but will not have cystic fibrosis. The Punnett square visually organizes these allele combinations, helping families understand the risks of passing on cystic fibrosis. This tool is particularly useful in genetic counseling for families with a history of cystic fibrosis. It can guide decisions about genetic testing and help educate families about the nature of recessive inheritance. In summary, the Punnett square is a straightforward yet powerful method to understand how cystic fibrosis is inherited. It illustrates the probabilities involved, making it easier for families to grasp their genetic risks and make informed decisions. Always remember, if you have questions about genetics or cystic fibrosis, consulting with a healthcare professional is essential for personalized advice.